Fernando's here.
Okay.
Here
Okay, great. There's no bridge behind me, but it's something that Dara put for me. Good morning, good afternoon, and good evening to everybody. And more than anything, thank you for David to agree to have a half-hour webinar with us. We're really delighted and very honored that you can be with us today. As you can see, we have young people and senior professionals from all over the world. We're covering 17 time zones and the 5 continents. And there were lots of questions that people wanted to ask you directly, but because of the time, the only thing we are going to do is to recognize them sometime during the session. For everybody, we are going to have 2 sessions. This is the main session, which is going to last 30 minutes, and it's going to be about COVID-19, and Dr. Nabarro is going to give us an update, plus his thoughts and his ideas about where the COVID pandemic is going. Okay, hello? Okay, and the second session will be comments or commentary on David's session by some of our students and young professionals, and then I will make some closing remarks. So I would like to thank all of you, and especially again, David, for being here. I sent you Dr. Navarro's bio data, and it will take me a long time to go over everything that he's done in his life. He's been with Ebola, started with children, child's health in Nepal and other places, and has been the head of the rollback malaria and part of the fund for against AIDS, malaria and tuberculosis on vaccinations. There are so many things that he's done that actually some people ask if he will tell us before he starts talking about COVID, how he came to this stage in his life. Most of us think that it's a linear trajectory, but I think Dr. Nabarro has been putting together pieces of a jigsaw from different parts of his experiences. And we would like to know, if you don't know that, and if you cannot think about that, Dr. Nabarro started, like most of you, working in the community in York with a group called Youth Action. We are not going to go back to his childhood, but people want to know, because this is also a mentoring session, how did you become what you are now, David? In a few words, on as long as you want, before you give us your thoughts and your presentation on COVID-19. Would you please do that?
Thank you very much indeed, Fernando. Actually, the fun is for me, and the thanks come from me, because in my work, what I've really enjoyed doing more than anything else is learning from people in the places where they work and from the people who they love, because the kind of work I've done has been always enriched by those who really care and who want to make the world a better place, a more equitable place, a healthier place, with the best of their skills. And yes, I've done a lot of different jobs. I sometimes feel that it's because I'm a bit impatient and I'm in a place and then I find there's an opportunity to do something else and I make a jump. But perhaps the most important part of it is just a total and constant belief in the power of the human and the human being, and then the collective of human beings when working together just to make the world a better place. I think we humans are capable of much better than what we're doing at the moment. I think we are designed to be much more effective learners and then actors, and I think most of all leaders. And I've seen leadership potential in just about everybody with whom I've worked. And so I'm committed in everything I do to try to help everybody else I work with to become the best leader they can and in the process, to help me to learn the things that I need to do better. Of course, I started out in medicine, and that was a wonderful, wonderful beginning of my career. But because fairly early on, I saw that people's health was influenced by so much more than whether or not they were free of disease, I quite quickly became somebody who got into the characteristics of how people live, really also the different facets of their lives, and the power structures that determined the opportunities they had, and sometimes also the difficulties they faced. I was always somebody who thought and worked in systems. I was never somebody who wanted to stay in a particular discipline, nor did I want to be bounded by particular patterns of thought. And it was this curiosity of being a systems thinker and then a systems worker, and I suppose over time a systems leader, that has led me to explore, to build across disciplines, build across professions, and then all the time work with people seeking to enable them to do better. Now, having operated in settings where I've worked on communicable diseases, community development, food and agriculture, sustainable development, climate change, I find myself once again back working on a health issue, but it's one that's linked to the different health tasks that I've done over time. But I was discussing it today with one of my former bosses, Gro Harlem Brundtland of Norway, who used to be Director General of WHO. And she was saying to me, David, you, like me, are one of these doctors who's not been prepared to stay in the confines of your own discipline. You very much like to work across disciplines because that's what gives you greatest satisfaction. If somebody said to me, describe yourself in 3 words, I would say an interdisciplinary professional focusing on people. And I hope that I will be able to continue doing that for the duration of my professional life. What I'd like to do today, Fernando, if it's okay, is to spend about 30 minutes from now focusing on the questions that the group sent in. I'm going to try to amalgamate some of these questions because they're quite complex and they take up quite a lot of time to answer. And indeed, time is always not on my side, so I may have to be a little bit quick, and I hope you won't mind. Just a couple of minutes about my role as Special Envoy to the World Health Organization. The role that's been given to me by Dr. Tedros, the Director General, when we met on the 31st of January, can be put into 4 words. I'll give you the words and then I'll expand on them. I'm to amplify, to interpret, to accompany, and to feedback. I'm to amplify the guidance being given by the professional teams in the World Health Organization Secretariat. I'm to interpret it to different groups throughout the world with a particular focus on Europe and North America. I'm to accompany decision makers, whether they're in government, in civil society, in business, in the professions, in universities, and indeed wherever, so that as they are trying to make sense of the realities of COVID, I'm alongside them, because what matters is how they themselves come to terms with this new reality. And then I'm to feed back on what I'm finding to Dr. Tedros and his teams, whether they are at the country level or in the regional offices of WHO or in the headquarters in Geneva. And I'm loving it, but it's really difficult because COVID is like no other problem that I've ever encountered in my professional life. And it's going on. I don't think we're anything near even halfway through the issues raised by COVID. And so this, I think, is going to keep me and my co-workers, there are 9 of us in our team at the moment in 4SD, it's going to keep us all occupied for many weeks and months to come. So to all of you in MultiPOD Mentoring, I don't see this as my only encounter with you. I'm terribly pleased to be connected to you. And one of my challenges in life is always trying to find enough time, enough hours in the day to do my functions and to do them to my best ability, because this is so huge. So your questions were many, and what I'm going to do is I'm going to try to bundle them and then to answer them. And if you find that at any point I'm going too fast, Fernando, could you please wave? Although I'm looking at the camera, I'll be able to see, there you go, I'll be able to see your hand going up to the top of your bridge, and we'll be able to talk about it. So the first questions relate to really COVID pandemics, and then the COVID pandemic and what's going to happen as we go through the current early waves of COVID infection and move into a world where we'll get used to COVID and perhaps be more ready for it and less overwhelmed by it as it comes into our countries. And the first question is, what's the difference between COVID and previous pandemics? Well, I've worked on influenza pandemics. I've worked on outbreaks of Ebola and cholera, and also of SARS. And just very quickly, this is a pandemic that's caused by a coronavirus. There are only 6 coronaviruses known. One caused SARS in 2003, one caused MERS a few years later. There's one that causes the common cold, but there are not many others. What we know about coronaviruses is that they're really unpleasant viruses, and they can really make people extremely ill. The illness is caused by the virus itself. It's also caused by the host response to the virus. And because hosts, i.e. people, respond to the virus in different ways, that means that the illness presents in a lot of different ways. COVID and the coronavirus, what's called new novel coronavirus SARS-2, is actually quite a stable virus, and I suspect that it's going to stick with us without changing very much for some years to come. It's a respiratory pathogen primarily, and it's transmitted by person-to-person contact. It's through droplets, and that means that what happens is that an outbreak starts with an individual, then spreads to others, and it builds up through this person-to-person contact quite quickly. This new coronavirus is highly transmissible, but not very lethal. It's much less lethal than SARS was in 2003, and that makes it particularly dangerous. A very lethal virus doesn't really cause a major outbreak because those who get the disease tend to die, and that means outbreaks subside very quickly. But this is highly transmissible with an R0 of about 3, which means that under normal circumstances, one individual will infect 3 others during the course of their illness. And because its fatality rate is quite low, it means that the virus really does spread quickly. And there are a lot of people with the disease who have very mild symptoms, and that makes actually managing the outbreaks extremely difficult. So the key aspects, next question, that policymakers must consider relate to how on earth to stop outbreaks from building up quickly, and how then we will be able to have societies that can live with the constant threat of COVID without being totally paralyzed in terms of social relations or economic activity. And then if an outbreak does build up, like we saw happening in New York recently, or in Northern Italy, or in Wuhan in China, how to suppress that super fast. The key lesson for policymakers is don't wait around while the outbreak is developing, but act very, very quickly as soon as you see your first cases. But concentrate on where the virus is and make sure that you suppress transmission quickly through interrupting the transmission of virus from person to person through case detection, isolation, contact tracing, isolating contacts, and protecting those who are most vulnerable. And that very basic activity of isolation and contact tracing and isolating the contacts is the absolute core of preventing COVID outbreaks from growing. And it's that capacity that's going to be needed in all societies throughout our world for the foreseeable future. there's nothing else to do. But in order to reduce the likelihood of the virus to being transmitted from person to person, there are various things that we can do to help. The first is very good hygiene in order particularly to try to make sure that transmission doesn't occur. It's hand hygiene, it's respiratory hygiene, and it's also making certain that those who are most vulnerable can all the time be protected. Respiratory hygiene means managing how you cough and other aspects of respiratory etiquette. It may mean wearing face protection in order to reduce the likelihood that if you've got the disease, you transmit it to others. And it does mean physical distancing, maintaining 1 meter distance from other people in case they might have the virus, ideally 2 meters, and that physical distancing is key. Of course, there are many occupations within which physical distancing is difficult. There are many patterns of life within which physical distancing must be practiced. And that's where policymakers have a key role to try to make sure that physical distancing is possible. Also, there are key occupations where the risk of infection is greater because the viral load to which we're exposed is high. Those are occupations to do with caring for people in health services, in hospitals in particular, but also in residential care facilities. And so we're asking policymakers everywhere to look at the health workers and to make sure they're protected and to make sure that they have opportunities to avoid infection, but also to look at residential care, because we've seen that in residential care, people are at particular risk. Because one thing that we've learned about this virus is that its lethality is much, much greater in older populations. I think it's about 40 times greater, it depends on which population you're looking at, in those who are over 65. Now, I am going to have trouble with time, so at what level and with what conditions can countries reopen their borders? Quite simply, countries need to be assured that their capacity to deal with the constant threat of COVID is the same as the capacity in other countries, so that when people are moving, they're unlikely or have a very low risk of carrying the virus from one country to the next. All judgments about borders are going to be risk related because there's going to be no guarantee of absolute freedom from COVID. And it's that capacity for communities and societies to be able to defend themselves against infection and to be able to respond to outbreaks that's going to be key. And we're going to see more and more countries looking at each other and saying, have we got the same alert and response capacity? If so, we might well open our borders. So we see Australia and New Zealand thinking about creating a bubble. We see Austria and Germany creating a bubble. And we may see soon some other countries in Europe, but right at the moment, the normal open border between France and Switzerland, which is visible out of my window, is completely closed with concrete barriers. Different tests are circulating. Which is the most efficient? Well, really, if you want to try to interrupt transmission due to COVID, you need to know who's got the virus, and you need tests that can detect the virus. The optimal test is using polymerase chain reaction, but it's quite an expensive and difficult test to implement, and scaling up PCR testing has been a real headache, and also in many developing countries, it's not widely available. There's another kind of test which looks for antibodies against the virus in the blood. The only difficulty with that is that you only get the antibodies building up after some days, and actually after somebody's been at their most infectious stage. So antibody tests are good for seeing whether people have had the virus and also for use in epidemiology. Most of the antibody tests that are available right now are not very reliable. They're either highly specific, but that means they're not very sensitive, or they're super sensitive, but that means they're not very specific. And so basically it's virus identification that's the most useful, using either a deep nasal swab or a deep throat swab. All of you know that this really is a problem. What's going to happen between now and when a vaccine is developed? I believe that it will be about 18 months before we've got a candidate vaccine that works and that's effective and that's also safe. And then the real challenge is going to be not having the vaccine and putting it through its tests, but manufacturing it in very large quantities and then having a system for equitable distribution. I've just been listening to Dr. Mike Ryan, the head of the WHO's Emergencies Department, and he's very clear that it's not going to be quick, even though we hear these stories of vaccine candidates appearing. And I'm saying to people, you might as well plan on 2.5 years towards vaccines are developed, and you can't have movement restrictions and borders closed for 2.5 years. The consequences, particularly economic consequences for poor people, are absolutely terrible. And so I'm saying we've got to develop the changes in our personal behavior and the absolute build out of public health capacity so that we can live with this virus as a constant threat, plus have hospitals repurposed so that they can treat people with COVID quick. And that's going to be hard work so that we can actually get calm and better able to cope with this threat and have the economies restarting because 2.5 years is a long time to go on like this. Quite a lot of people in Nigeria don't believe that COVID-19 exists or worry about it, what to do to address this. I want to stress to you that actually every one of the 7.8 billion people in our world is having to come to terms with the new reality of COVID as a threat. And it's something that's so unexpected and so unusual that we should not get at all nervous that different people are coming to terms with this at different times. Part of all of our role is to stimulate dialogue and discussion and questioning in our families, in our communities, in our professional workplaces, in our businesses, and really encourage this debate, because the sense making about COVID is going to take some time. There's a lot of fear and anger as well, but don't let anybody tell you that just because there's 1 or 2 cases, we shouldn't worry about it. We should put we should not even take it seriously. If you turn your back on this virus, as has happened in some Western European and North American countries for several weeks, you get explosive outbreaks and terrible problems in health services, plus mass death among older people or people with diabetes or hypertension. And this virus, I keep having to remind people, is horribly dangerous and has all sorts of features that we haven't yet learned about in the last 5 months since we first knew it. So tell people we've got to worry about COVID alongside the other issues we've got to worry about, like childhood diseases or malaria. And what's the experiences that different nations have gone through? What are some of the lessons we've learned that we can take into consideration for the future? Most important lesson, don't underinvest in community-based public health services. It's been given far too little attention over recent years. We've watched the seriousness of public health just drop. Too much money of national health budgets has gone into hospital services at the expense of basic public health, at the expense of community health workers, at the expense of surveillance, at the expense of the ability to deal with infectious diseases. Time to redress that. We should be giving just as much attention to health threats as we do to security threats. And we know how much money is put into arms, trillions of dollars a year. Let's put the same into public health. What to do about food insecurity and malnutrition as a result of the containment of COVID-19? Super urgent problem. We are watching at the moment. Millions of people face the possibility of food insecurity and millions of children likely to become severely malnourished because of lack of access to food. It's absolutely essential to prioritize food security and nutrition at this time, and to not ignore it just because you can't see it. There is food insecurity. There is growing malnutrition. How do you recommend then that policymakers determine the impact of response measures on inequalities and vulnerabilities? This COVID is revealing the fragilities in our existing systems all over the place. Poor people are suffering the most. Poor people find it hard to work from home. Poor people often have to work in circumstances where you have to be close together. Poor people are in the informal economy. The informal economy is being hit badly. Often the poor people who have been most affected in many countries belong to particular ethnicities. Look out for that. Who's dying the most in Western Europe and North America right now? Yes, it's men. but it's men who are non-Caucasian, men from ethnic minorities. A lot of them are in health worker jobs as well. And as a result of the containment measures, there is a great increase in mental ill health, and there's a lot of domestic violence going on. All these things have to be put right at the top, because this is a systems issue and we've got to look at all the systems. So how to protect populations who suffer from health inequity? Answer: this COVID really does precipitate inequities. WHO is having to cope with many accusations right now. First of all, there are accusations that we have given excess attention to certain countries and not really been equitable in our attention. WHO is an organization of health professionals, and it's based in country offices, regional offices, and it has a global health headquarters, and it has networks that link together public health professionals all over the world. There's one set of values that underline public health that many of you actually aspire to, and that is that every human life has the same value, regardless of your national origin, your ethnicity, your age, and indeed your sexuality and your sex indeed. So because we have that basic view, because we are interested in equity, sometimes we are found wanting by those who are running things like the World Health Organization, who belong to different political groups and who run different countries. Within the community of health experts that are inside the WHO, we are working flat out for the public good. But occasionally our bosses, who are the governors of the WHO, have differences of opinion between them. Right now, those of us inside the organization are doing everything we can to make sure that people everywhere can access tests that they need that work, can access protective equipment that works, can access treatments that are shown to be effective and not access treatments that are ineffective. That's what we do. And we'll go on doing it, even if those who govern the WHO are riven with political infighting and disagreements. It's going to be very challenging in the next week as we move into the virtual World Health Assembly on May the 18th. But we won't give up, regardless of what the various bosses are going to do in terms of cutting off our finance or other things like that, because we're driven by the values of public health, as are many of you. And we know that you can't have a functioning economy, you can't have political stability if there are health inequities everywhere. We've seen it so many times and we're seeing it again now. So we're going to make recommendations all the time for involving everybody in the work of WHO. I keep on hearing from people saying, why aren't younger people participating, whether they're attending from their national governments or whether they're part of the broader World Health Organization governance? I say this health organization for the world should have full participation of young people, focusing on issues that are relevant to them, not just now while they're young, but also as they get older, because they're the next generation. What we do, our legacy, is your inheritance, and we have to make sure that that is really at the top of our minds and that your issues are taken seriously. I would like every person in the world who cares about the future to be signing a petition asking world leaders to stop squabbling and come together in unity, because this is a global issue. It needs a global response and we have to work on it together. It's totally unconscionable that world leaders are finding reasons to squabble over an issue like why the World Health Organization has or has not done this or that at this time. Let them investigate, as they always do after any outbreak, but do it when we've got things through the present state. Don't threaten the World Health Organization with a 20% cut in its totally minuscule budget, 1/3 of the US CDC as it is. Don't try to cut it off 20% right now, just as everybody is working flat out, totally exhausted, but totally dedicated to deal with this challenge. Do you think the pandemic will affect health systems in the future? Of course it will. There will no longer be a situation where people are prepared to run with underfunded health services, underpaid health staff, and that 75% of whom are women, often on 0 hours contracts, having to do multiple jobs in order to make ends meet. If they do go on doing that, then they need to search their consciences. The world needs health services, particularly public health services. The world needs properly paid health professionals who are given the right status in society. And the world needs good health and health equity for a safe and secure future. You can't run the world with terrible inequities in health. Sickness in one part of the world will lead to challenges in other parts of the world, and we must have health equity for the sake of our future. And the sooner our leaders understand that, the better. And I, for one, will be working for this right through till I cannot work anymore, where my brain doesn't work or something. I'm going to go on doing it, and I'm not going to give up. And I think the community of health actors needs to unite now more than ever, steadfast for health equity and indeed for equality of health opportunity everywhere. It is an utter disgrace that we have a situation now where masks and protective equipment are being stockpiled by wealthy nations. And I'm hearing all the time of people working in poor nations who can't get a mask, who can't get PPE, who can't get basic equipment in order to care for people who desperately need attention, not just for COVID, but for so many other diseases. It's wrong. So thank you very much indeed for collaborating with us. We've been involved in our little group 4SD in mentoring leaders, but we don't think leaders are just the bosses. In fact, we think the reverse. We think the best leaders are everywhere in society. Leaders are in families, leaders are in communities, leaders are in businesses, but they're not always the boss people. They're everywhere. Everyone has leadership potential. We lead not by telling other people what to do, not by commanding and controlling, but by supporting and empowering and bringing people together for the common good. We give space to everybody to give opportunities to express their views. We respect the views of everybody, whoever they are. We include all those. It's not impossible. Don't believe anybody who says the only way you can lead is by exclusion. It's not true. Don't believe anybody who says only a few people have got the gift to lead. It's not true. Everybody has leadership potential inside them, because leadership is simply helping others to do and be better. And everybody has the capacity to be better, because humans have the capacity to be better. Because not only are we dealing with COVID, but we're dealing with terrible problems of inequity, terrible problems of the damage to nature, an extraordinary challenge with climate change. And we humans must not be defeated by these challenges. We've got brilliant brains, brilliant hearts, brilliant souls. And it's through working together and getting the best out of that capacity that we will help ensure that this world is a good place for all, but not for people of my age, but for people in their 20s, but for people who've just been born, and for the people who are going to be born in the decades to come, because we're not working just for us. We're always working for the future. We do open online briefings in 4SD. They are interactive. We have briefings that are to do with the things that are happening at the time, and then we have question and answer sessions. Sometimes people participate, opening their mics to make brief comments, and we've tried to make Zooming fun rather than Zooming just something we go on doing all the time because we can't meet. We'd love you to join them if you want, and we really value participation, particularly of people who are younger. And so these are done actually on Tuesday evenings, and we also do them on Thursday mornings. I'm talking about European time. Tuesday evenings so that people who are east of us can join at some kind of, Tuesday evenings so that people who are west of us can join at some time that's good for them. And Thursday mornings so that people who are east of us can join. And we have a website called www.4sd.info. I'm not advertising anything because we don't charge for it, or it's actually just a service. But just if you want to join, the stuff is there. And our colleague Thuy, T-H-U-Y, you can see her. She's got green behind her. She's got nice background, like Fernando. Just link up with Thuy. She's there. She will support. Now, you've been doing something wonderful. I want to thank you all. We've been, with Thuy's help, linking up with groups around the world who've been taking some of the narratives that we develop in words and in our online briefing and putting them into short videos to try to make them easy and accessible, like 1.5 minutes. So you click on it and you get the story. But what have you done? You've translated them to so many different languages, and we've been now putting them as subtitles. We're trying to actually, what they call, burn them onto the videos. I don't know the technical term, but what a beautiful thing to do, because it's no good just talking in one language, the English, the language that I speak, English. We need them in every language, because people can't make sense of all this unless they can make sense of it in their own language. I love the idea of mentoring. You know what mentoring is? It's that somebody who has skills can share them with somebody else who hasn't got skills. But as we've all got skills, the beauty of mentoring is that it is a two-way or a multi-way process. I loved it when Fernando contacted me. We'd known each other professionally before, and I really love and respect this guy. And he said to me, I do this thing called MultiPOD Mentoring, and we're kind of family. Can we connect? And it's taken us some time to make it happen. I think that's always the case in fun things. You're always busy. But Fernando, thank you for this chance. Thank you for the chance to meet briefly with some of your teams. Thank you for helping us do this. And the last question that I just want to address is this. You've been doing this for about 30 years. Actually, it's more. I'm going to admit it's 45 years. You can work out how old I am. How do you keep your hope and trust high no matter what? I'm going to go back to what I said at the beginning. I believe in humanity. And I believe in love as the force that, that really brings together humanity to work for good. Love is an unconditional capacity of people to be able to work with each other and to trust each other for the common good. And I believe that humans have the potential to practice this in everything they do. And through that, I believe that through the collection of our energy and our capacity to share and show empathy, we can be transformative creatures. And so it's that keeps me going. It's not some kind of naive optimism. I'm as hard as nails when it comes to working out what's good and what's right and smelling out what's bad and what's wrong. So it's not naivety. It's actually a recognition of the capacity of the human being, the human spirit, and the ability that we have as part of the wider natural family in our world, all the living essence of our world, that we can make the world a better place. We're not unique. We're not the only living creatures in the world. There is so much life around. And by humans connecting properly with nature and all life in the world, we can do extraordinary things. It's our precious world, and we're going to make sure that it's there to be good for generations to come. So that's what keeps me going, and I don't give up. Thanks a lot. And I now shift on, and I wish you all well. I clap you for all you do, and I really, really send all my best to you all. Thanks.
Thank you, David. Thank you very much for this wonderful, I would say, chat among friends. And this is actually what we expected from you, a session in which you gave us your knowledge, your experience, but also your advice. And you share with us your experience and parts of your life, and we are tremendously grateful for your message. Thank you very much again. And here you have people from all over the world. Okay, thank you. Well, I didn't introduce myself. I know almost all of you, and I'm not going to say the names of everybody. I am not in jail because I can see a number instead of Fernando Zacarías. I don't know if you can see the gallery. I'm not in jail. My name is Fernando Zacarías, and I'm the principal mentor and the program coordinator from MultiPOD Mentoring. I'm not going to mention anything because most of you are part of MultiPOD Mentoring. But I see some people from my past, and Marie Kimball, who is a doctor, who is an expert in COVID because she lives in Seattle, and she was in the center of in the epicenter of the epidemic in the US. She's been giving advice through TV and answering tough questions. We have seen you there, and Marie. And then I wanted to recognize Dara. You can see Dara, wave, Dara, please. Dara is working with me and is the one organizing from our side this webinar. I want also to recognize Tui. Where are you, Tui? Oh, Tui has all the plans that I envy so much. Tui Nguyen is with Dr. Nabarro's team, and she's the one in charge of communication and the one who really helped us organize this meeting. I won't say too many things about people, but I almost want to say the names, or at least something that I remember. First, we have Florence Laben, which is also with the group of Dr. Nabarro, and she's the boss. David Nabarro is her husband. She's not his wife. David Nabarro is her husband. Then we have my friend Alberto from Cali, Colombia, Hugo Prado from Bolivia, from La Paz, Dr. Fenano from Senegal, Kofi Adasi from Ghana, Michel Mata from Lebanon, and now in Lyon, Jose Romero from Mexico, my good friends Liz and Ron Anderson in Canada, Ife, who is from Nigeria, but she's living now in the UK. No, not in Amsterdam. No, that's correct. Laura from the US, Viveka Guzman, now in Ireland. She's from Mexico. Sabrina Ebert, my friend from Germany. Nelly and Saad, I'm going to skip you because you are going to be the ones giving the commentary. Kathy Wabnitz, who is at the School of Hygiene and Tropical Medicine in London. She's from Germany. And by the way, I don't know if you know that the director, Peter Piot, went through an ordeal with coronavirus. And he survived that. He's home. He wrote a very good essay about what it is to be a patient. We have Layal from Lebanon, Charlie Shang from China. She's the one who helped with the translation into Mandarin of the first video. We have Shadme from Turkey. We have Anna Tokar and Deni Terteli. They did the translation into Russian of the first video. Steve, how are you, my friend? You got up at 7:30 in the morning. We have Erin, and Slade, and Steve in Vancouver. So they were the early birds. They have Vitarillo Mulimba in Kenya. Sorry I'm taking so much time, but I really wanted to recognize all of you. Erin, how are you? How's medical school? Hernan Rosenberg, who is sleeping almost. Elizabeth Mason, how are you? Okay. Jane Delgado, from a wonderful organization, a supporter of MultiPOD Mentoring. She's in charge of the Hispanic Alliance that gathers or has more than 1 million members in the US, and now is expanding its reach to Latin America. It's the largest organization working on health in the US, directed to the Latino, to the Hispanic population. Diraj, my friend from Nepal, down in Belgium. BJs, we cannot see you, so I'm going to skip you. The previous president of GIA, Juan Manuel Sotelo from Peru, who lives here in Washington. Rafael Massin, who also worked with me. Marilyn Rice, also a nurse, a mentor. Mahabal Wazir, also from the MENA region. My dear niece, Veronica Foubert. Samir Abu Hamad, congratulations. He just became a doctor on the 16th of May. Okay. And Xiomara from Peru, working in Paris. Okay, I don't know if I'm going to continue with that. I think I could take half an hour in mentioning all of you. Some of the people I do not know personally are Christos Zacarías from Greece. And who else? Oh, Stanley from Bolivia too. Anna Fruhauf, who helped us with the organization of our meeting at the World Health Summit last October. And I think I'm just going to recognize a few more people. And let me see, Mariela, Priyanka Shrestha. Brian Wong, we haven't seen you since 2017, but we see you occasionally in the LinkedIn place. And who else? We have Eric, sorry, Beatriz, okay. Jacobo Finkelman, Zaira in Mexico, she's my sister, okay. And sorry, I cannot recognize everybody, but I would like to ask Tui. We had only 15 minutes left. I'm asking if it's possible to continue for those who want to stay, to continue for a few more minutes, perhaps 20 or 30 minutes, because I'm sure that other people would like to comment. And I would also like to make a comment at the end of this session. So do you think it would be possible to continue, let's say until 5:30? I asked David and he didn't have more time, but can we continue for half an hour for those who want to stay? Yes? Okay.
Yes.
Okay. Okay, wonderful. So what I would like to do now is to ask Saad Wakas from Morocco, well, he's going to introduce himself, to make some comments about the presentation we have just heard. And then we'll have Nelly, where is the, oh, Nelly Ceretti, also give a few comments. Then we can open for a few questions or comments, not questions, well, questions to everybody or comments, and then I will give you some parting remarks or closing remarks. Okay, and let me tell you, this is the first on a series of webinars. So we wanted to see how it worked, and it seems that it's going to work very well. So without anything else to do, I asked Saad Wakas tell us what he thought about the session. And also, please, Saad, if you will say something about the organization that you belong to, because we have here representatives of Young Leaders for Health, Women in Health, the Coalition for Global Health Innovation. Who else is here? People who have attended the Unleash sessions. And I don't know if well, there are many organizations represented here. So please, Saad, tell us about what you thought about the presentation.
Thank you very much, Dr. Fernando, and also big thanks to Dr. Nabarro for being here with us today. So presenting myself, I'm Saad Wakas, a panel of medical students from Morocco, and I am the coordinator of the COVID campaign of the International Federation of Medical Students Associations, IFMC. So first, this session was a great opportunity for us to get a little in the shoes of Dr. Nabarro and the team that are trying to manage the COVID, and also how we as young people can take an action. It was kind of enlightening for us to see what are some of the maybe the focus areas or the areas that we can take an action on when we talk about advocacy, when we talk about linking to the governments, and also the points where he emphasizes on the importance or the role that we as young people should play in our communities and also on the global level, which I completely agree on and believe on its importance. And I also believe that as young people, we have the power to not only reach out to the population, but also to create our networks, because we can relate with each other, and this networking power makes the privilege and makes us special and opens us doors for more and more impact. So quickly, I would like to share with you 4 learning lessons that I had the chance to learn as the coordinator of the IFMSA COVID campaign in the past 3 months. And basically the first lesson that I got is that as a network or as a group, you cannot force on people what to do, but also what you should do is educate and empower them and let them do actions in their own way. And this is what we've been focused on in the website that I shared with you in the comments. You can see our action responses. So that we've been focusing on empowering medical students and members throughout the world, giving them library folders, resources from WHO, and also related to different sectors such as sexual and reproductive health and rights, climate change and health, also mental health and human rights related to COVID. We did a list of webinars, and also we had a list of medical education softwares and platforms that we partnered with to improve and offer the chance to students to improve their medical education. We also developed a training program that we shared with medical students to empower themselves and be able to take action nationally. And now in the upcoming days, starting from tomorrow, we will have the virtual pre-WHA program where we will gather 60 young, brilliant medical health students in general to empower them about COVID and also meaningful youth participation. The next lesson that I have learned is that the importance of networking and partnerships. And this is very, very crucial. And we've been trying to focus on that. We've been working with the UNFPA and other youth organizations in the Youth Against COVID campaign. That was a series of video campaigns that we've been doing. And I've seen that together we've been able to get things done in a better way and also reach more people. We had an open letter to governments encouraging and calling for UHC and sustainability with other youth organizations. We also had a partnership with UNICEF and the UN Youth Envoy in some webinars. And also we've been focusing with WHO to work on fact-checking and fighting misinformation. So we did a survey and we have mapped up until now 155 initiatives and websites that are fighting misinformation and myths. The third lesson I have learned is that the real impact is done on the local level. What I mean by that is that I've seen what we've been doing not internationally, but when I compare it to what I've seen medical students doing in more than 96 countries up until now, people focusing on awareness, raising the awareness of the population, doing videos, TV and radio sessions, journals, educating and training populations, educating and training medical students, health professionals, and also doing actions in the food, like sharing food drives with vulnerable populations, doing and encouraging blood donation, also participating in call centers, doing hotlines for gender-based violence, also supporting mental health of the population, fighting stigma. So all those actions are on the local level. And this brings me to my final lesson, which is that health is not only related to health, and COVID is not only affecting the health, but affecting all the SDGs and the aspects of life. And with that, I would like to focus and emphasize on the role that we as young people can play. Like anyone related or not related to health can have a role in there, and yeah, an action in there. And this is why we should like get with each other, network with each other, and see how we can act the best as we can. So with that, I would like to thank you for giving me the floor, and yeah.
Didn't say something about the IFM-SA, and actually has 1.3 million members in 125 countries. So the world is in good hands. And Saad is in charge of the COVID-19 initiative for that group of young people from all over the world. So thank you, Saad, and I will give the floor now to Nelly. And Nelly, please introduce yourself and tell us what you want to say.
Hello, I'm Nelly, as was already said, and I have a Master of Public Health from Lund University in Sweden, and I'm currently working as a data analyst and happen to be involved with some COVID projects. So thanks for letting me make one little comment. I don't think I can add a lot to what Saad said. You had a very good comment, but I think what Dr. Nabarro touched on, among other things, one of the very important things I think is the fact that there is for sure a lot of, I would say, political disagreement right now, and especially keeping in mind the fact that I'm currently speaking from Sweden, which has been in the spotlight, so to say, with their approach and the whole intervention and social intervention being quite different. I think it's still a great reminder that even though there may be differences, there may be disagreements and people believe in different things, I think it's a great reminder to just keep listening to each other and keep in mind that nobody really knows a lot about this. I think we're all in the same boat when it comes to kind of being a very novel thing. And it's important to just keep listening to each other and learning from each other and staying open to others' opinions. This is not me defending anybody's strategies. I think it's just me keeping in mind that it's important to be reflective and being open to others' opinions. And he also said, he mentioned nutrition, which I think is not a very obvious side effect, so to say, of COVID, which is also a kind of another reminder that it's great to look beyond the obvious and ask more questions than just is on the surface. I think that's very important. And like Dr. Nabarro said, I think we can be transformative creatures, and networking is important, and it may not be something big, but I think it's important to just keep doing even the tiniest things we can, use our opportunities. Keep in mind that education is privilege, and I think Saad mentioned perfect resources. So keep attending webinars, educate yourself. Misinformation right now, as also Saad mentioned, is quite important. It's very powerful, and I think we are very powerful in empowering not only others, but ourselves. Just educating ourselves, learning more, making sure we don't fall victim to misinformation, and just promoting education and empowering. And as Dr. Nabarro said, we lead by lifting others, and I think we all can do that in whatever little ways we can. So yeah, thanks for letting me make my 2 cents on this.
Thank you, Nelly. What you don't know is that Nelly, as a statistician, did an analysis of the COVID situation in Sweden. Now we can say what happened in Sweden, because they have opened, they were not in lockdown like the rest of the countries. And some of the questions were quite interesting, and some pointed out to the differences in the countries. For example, somebody, I think it was Bits Mulimba, who talked about the example of Senegal, in which they didn't have the means to do everything that should be done from the viewpoint of the technical, professional, medical viewpoint, but still they don't have the explosive epidemic that we have in other countries. So what I would like to do now is perhaps we can have time for 3 comments, one by a mentor who is dying to say something, and it would be first come, first serve basis, and 2 of our young people. But they would have to be very short because we are over the time. So first, mentors, who wants to say something from
Fernando,
our...
you let me know who I can unmute. I leave the power to you.
Pardon?
You let me know who you would like to speak and I will unmute them.
Okay. So let me see, it's difficult. Now I need to make a decision. What about, I saw Marilyn Rice raise her hand, please. Marilyn Rice.
Thank you, Fernando, and thank you all for this wonderful experience. I hope we can do more of this. I just want to emphasize the need, I think a critical need, to address the issue of misinformation. With social media, there is so much information out there. I think it's very difficult for people to know what the facts are and what the reality is. So I think those of us that are in a position to be able to advocate for the right information need to be doing that collectively, not just individually. To me, that is a really, really critical point. Also, I would hope that looking down the line, maybe WHO could be taking more of a leadership role in terms of looking at addressing some of the issues that David mentioned in terms of some of the side effects, especially in terms of inequities, looking at issues of nutrition, looking at how countries can support each other in terms of providing not only protective gear, but also getting food to the people that most need it, getting resources to the people that most need it. I won't go on because I know many others want to speak. Thank you so much.
Okay, thank you, Marilyn. Okay, I don't know whom to choose of all the young people. And there are so many, and all of you are stars. I mean, you know what I think? We are going to ask one of the victims of the time zones from Tokyo is Haruko. Are you there? I don't think she has the camera. Oh, yeah, she's there. Okay, will you move your PC a little bit so that we can see all of you? Or not all of you. Yeah, that's right. Okay. Okay. Haruko, please tell us the time.
Hello, everyone. Thank you very much for this insightful webinar. I am one of the victims of time zone. It's half midnight. I'm sleepy actually. Well, I haven't prepared any comments, but well, it's very good to hear from David Nabarro and also from the members of MultiPOD members. As I'm working from home in Tokyo, it's a bit difficult to listen from people around the world. I'd like to use the knowledge I learned today in my daily life and my work. Yep. So yeah, I really appreciate this opportunity. Thank you very much.
Wonderful, Haruko. Thank you. Thank you very much. Okay, can you hear me? Nobody? Oh, Vitarillo, please. Is Vitarillo Mulimba?
Yes.
From Kenya, Tanzania, and
Good evening, everyone. It's 5:38 p.m. Currently I am in Gothenburg, Sweden. I really appreciate this Zoom meeting because I have gathered that WHO is working effortlessly to contain the COVID virus, but unknown to us who think that they're just giving directives, I've also realized that they are also trying to stabilize themselves within the organization and also fight to stay as the head of health in the world. So I really appreciate that because it also gives me a perspective that not everywhere is smooth sailing. And also, I'm also from Tanzania, and if you read from the news that the president there has not taken COVID-19 as seriously as many of the other countries have, because he claims that the test kits are giving a lot of false positives. So in a way, this has also undermined the severity of the coronavirus pandemic in the world, because if you have a leader saying, oh, we have false positives, so the positive people who are tested do not have the disease. So this is scary because yes, they might be false kits and false and contaminated PPE, but I think leaders should not take away from the fact that there are people who will die from this disease, and those who are vulnerable should be informed and also be given the opportunity to seek medical care and not to fear to get tested or request being tested. So I think that is also something that we should also try and look out for in our individual countries.
Okay.
Thank you.
Thank you very much, Bits. I see also my good friend Paul Gewa from Senegal. He's the director of a very well-known institute in Navarra, Spain. And thank you for joining us, Paul. Now, if you allow me, I want to thank everybody. I cannot continue talking about who is here, but I just want you to know that at MultiPod, we have more than 70 countries represented, mentees and mentors, working or being born in different countries. We have more than 50 languages, and that's why we are working with Dr. Nabarro's group, because we are the ones who can do that. Translate the videos and the narratives into so many languages so that they can be distributed all over the world in the original languages of many people, including some of the American languages. Finally, we have Nahuatl, we may have Guarani, and perhaps if Hugo help us find somebody with Aymara or Quechua, that would be great. Okay, so that we can add 2 languages. And something else that I want you to know is that we represent more than 35 disciplines, and only less than 15–20% are physicians or medical students. And that is the approach that we should have to global health. We need all disciplines and all sectors to work in climate change and all the main issues that we will be facing. So I wanted to tell you that MultiPod has already established itself as one of the programs, I think the best, on international health and global health, with this possibility of having long-distance mentoring. What I would like to do now is almost as a summary of I didn't know what he was going to say. So I'm going to add a few concepts that I think are basic, and then leave you with 3 questions. So I'm going to share my screen. Okay. I'm going to tell you something very fast. These are only a few slides. And I wanted to relate the natural history of disease. Some of you, or many of you, are not directly related to the health area. Some of you are in music, in geography, and different disciplines, because we accept any brilliant people that we can find in any place in the world. But here you can see that the natural history of a disease is what happens when you don't have an intervention. You let the disease go because you don't have anything. And then what happens? It progresses, and most of the infectious diseases that I'm going to talk about lead you to recovery. Most people survive, but some people get into sequela and complications, chronicity, disability, and a few die, except in diseases such as rabies, which you have almost everybody dying of that. So if we can put a graph, you are exposed, you develop the infection, you develop the disease, and then you go to recovery, sequela, or death. And the point here is that this may take days, weeks, months, years, depending on the disease. For example, with syphilis, you will die many years later of complications of tertiary syphilis. In other cases, such as coronavirus, you will have the complications very early. Let me see if I can move you someplace else, because no, I cannot move that. Okay, so at the bottom, let me see if I can, how do I move? Okay, here, I'm going to put you. Sorry, everybody. We have the exposure without infection, infection without clinical illness, mild illness, severe disease, and death. And then you have recovery, complications, disability. Now, what I would like to talk about is that you start with observation. An observation could be in the community through surveillance, And then you can go through screening and detection, disease detection and diagnosis. And there are different types of individuals. Remember that global health is not only public health, but includes individual health, medical, and other health specialties. So for the clinical disease, you need to have a case definition and be able to make a diagnosis. Next one. And these are the actions and interventions that we can have. Some of them have to do with primary prevention, secondary prevention, tertiary prevention, but people do not include social mobilization as one of the interventions. And this is something relatively new that we learned with the AIDS pandemic, because before we were not considering that. So this is what you do, on whom, how you do it, and what are the expected results. And I'm not going to go over the table. This is being recorded, and I think all of you have already this presentation. But my point is, in addition to that, no, can you go back? Can you go back, please? Okay. I take this opportunity to tell you one more thing. If you are a consultant, you give your clients advice on what to do and on whom. But if you are a really good consultant, you should always tell them how to do it. And don't be afraid of the word persuasion. When you say information, that health promotion, etc., what you are doing is persuading people. And of course, you have the primary prevention, vaccines and masks, and the expected result is avoidance of exposure and infection. This is where we are with the COVID infection and disease right now. So you can look at all of them, but if I can remove you here, what you have with social mobilization, and this is important, is not only the social, but the societal engagement, the intersectoral and multidisciplinary collaboration. And for that, how to do it? You need leadership, political power, financial and resource mobilization. And what you try to do is get people involved in their own health-seeking behavior. You need financing, and you need the restoration of the social functions. And this is what we are going to face with the COVID pandemic. Please, the next one. This is again just a graphic presentation of the natural history of the disease. In the case of AIDS, we got it at the end stages of the disease. Everybody died in the early 80s. In the case of COVID, we are getting it from the beginning of the disease towards the infection and to the exposure. This is where we are working. And next one. Okay, what we do there is to have the prevention. And here the important part is the timing and velocity. And you have the primary, secondary, and tertiary prevention. Sorry to be so rudimentary in my presentation. And in the case of time, your social mobilization requires timing and strength and power. And you get strength and power by numbers or by reaching people who have influence. Next one. This is not accurate 100%. And I put two examples of diseases that are transmitted via sex and two diseases that are transmitted via respiratory, affecting the respiratory tract. And this clinical discovery and epidemiological profile refer not to the clinical part or the epidemiology. It referred to the understanding of the disease. And in the case of syphilis, it took a long time to know what was going on. He probably would put centuries. At some point, Osler used to say that he who knows, there were not female doctors, he who knows syphilis knows medicine. And also the epidemiological profile took a long time to be understood. The effective action only started in the 1940s, and we saw medium to low public health results. Syphilis has not been eliminated. And there was no social change. Prostitutes continue to be blamed for syphilis and other venereal diseases, and people do some contact tracing in some of the countries who could afford it. In the case of AIDS, it was completely the opposite. The first reported cases were in June of 1981. By the end of that year, even before the virus, the retrovirus was isolated 2 years later, we already knew how to apply primary prevention with condoms, with changes in sexual behavior, with screening blood, although the tests were not available until 85, a series of measures that could be taken even before the agent was isolated. So we had the epidemiological profile, and effective action was in that decade. In that decade, we already started developing some medications, some drugs that could work, but it was not until 1996 that we had the cocktail. The public health results vary according to the countries and the populations, but are not bad. So people are even talking about eliminating or controlling AIDS by the year 2030. I don't think that's going to happen, but in some countries it will happen. What was very, very significant was the social change produced by AIDS. For the first time, people were involved at all levels of society, professions, you name it. And some of our understanding of sex also changed. Gay men, homosexual men, ceased to be gay men or homosexual men. The point there was behavior. So it was men who had sex with other men, for example. In the case of prostitutes, finally, society recognized that they don't do their activities because they love sex. It's an economic means to earn their living for themselves and their families. Here we have tuberculosis. Also, it was very slow to understand all the manifestations of tuberculosis. The epidemiological profile has taken also a long time to understand. And the first measures, and Jane Narayan is here, started really in the 1930s with the first sulfonamides and then continue, but you had to have cocktails of different drugs to be able to treat it. Public health results, again, they depend on the countries. And the social change, it was not big. It was not a big change. People didn't recognize, for example, the issues of crowding in homes and in other places. And now we have COVID-19. It was very fast. Days, weeks. Epidemiological profile, almost immediate. Days and weeks. Effective action, it works in 2020, but we do not know the public health results. But we do know that it has resulted in a profound social change. And I think this is what we are going to confront in the next few decades or few years, until we have a vaccine, until we have treatment. I do not know of any other disease, perhaps cholera on the 13th century, that changed the behavior of society in such a great way as this pandemic has done. All the countries, and you can see from all continents, people trying to wear masks or practicing social isolation, etc., etc. So This is the main challenge, I think. This is the main challenge. Next one, please. And I just want to show you a few, the COVID-19 pandemic. This is the problem. No, go back, please, go back. Okay, this is the problem. We know about the main severe complications of the disease, but we are still trying to discover all the clinical manifestations. For example, this new syndrome in children. What are the sequelae of the disease, neurological sequelae and others? And here you have the coronavirus, which is the agent of this disease. But it has also changed the way we practice medicine. The same way that AIDS did with all sorts of measures in the hospitals. Dentists didn't wear gloves before the AIDS epidemic. Now everybody wears gloves when they draw blood for tests, or when a dentist, when they examine or work on you. Next one. Next one there. I wanted also to illustrate this with the picorda virus and polio. This is the way it was. People got some forms of the disease. Very few, only about 3% of people got the paralytic form, and only very few got the bulbar form or other neurological complications that impeded the patient to breathe. So they had these negative pressure tanks, and there are some pictures where you can see full wards with all these machines. I myself and some of the older mentors can remember before the vaccine was available. I have a cousin that ended up in one of these concussions, one of these machines. And when we got, next one. Dr. Nabarro posed this question: who shall live? Of course, the people who can afford treatment or who live in countries where there is no discrimination or lack of access because of your social status or economic status or ethnicity may not have the same, will not have the same access to medical treatment, to vaccines, to treatments. So that is going to be an ethical and practical decision that all of you will have to face. All of you young people. The next one. And this is what people are doing now. Social isolation to avoid exposure. And how long will that go? Here in Virginia, where I live, they have extended the period to the end of May because we're still in the ascending curve of the pandemic. And all schools are closed until next year. So keep going, please. In the case of polio, we had first the Salk and then the Saving vaccine. And that saved many lives. And since 1991, polio was eliminated from the region of the Americas. And only a few countries are left with the problem of polio. Before, in the early 50s, every year when we started school, there will be at least one boy who returned on braces and crutches to school every February. So it was a real threat and a real problem, and public health burden and public health challenge to all of us. The next one, please. And in the case of the AIDS pandemic, the way it started in many countries, it was with social mobilization. And some of you may remember, this is an example in Washington, D.C. Every year on the 1st of December, people would come with these quilts. And each square of that quilt represented one person who had lost his or her life to AIDS. And that was the message that was given. And the communities were mobilized This is the first time that I have seen groups that were not socially accepted started moving and claiming and asking for their rights. And AIDS changed that. AIDS changed everything. And I'm going to leave you with 3 questions. Please, I think this is the last one. And some of you who have worked with me have heard these questions before. One is possibility. Why not? Why not? Why can't we have something that will prevent COVID or any epidemic and that will be available to everybody? The second one, what if? Probability. That this comes back every year, for example, or the probability that the vaccine is going to be 90% efficacious. And then fate. What now? What is going to happen? What is next? And if you take into account these 3 questions and you really ask yourself, what questions, what further questions come from this? Or what are the answers that I can give to each one of them? Then you will be on your way to finding solutions for these problems. And again, I have mentioned that many times before. The world, global health and human development is now in your hands. You millennials and you Generation Z and the other generations that will come after you. Because you have that responsibility and you will have the challenge of responding to these questions. Thank you very much. And this is the end of the seminar and session. There will be no questions because I have no answers. But I want to thank everybody for your participation in this first webinar of MultiPod. It took us, this is the 4th year of the program. And finally, we had somebody, Tui, Dr. Nabarro's group, and Dara, with the organizational aspects of from MultiPod, to make this a reality. So I want to thank all of you, most especially people in Vancouver and in Tokyo, early birds and night owls that stay for the whole meeting. Thank you very much, everybody.